LASIK, which is an acronym for Laser-Assisted In Situ Keratomiliosis, is the most commonly performed laser eye surgery and can be used to treat myopia, hyperopia, and astigmatism. The procedure has been around since 1991 and uses a laser to alter the shape of the cornea. I will be discussing the use of LASIK in patients with myopia. You probably already understand what laser-assisted means, but in situ keratomiliosis is a bit more complicated. Let's break down the words. In situ means in the original position or place. Kerato means cornea, and miliosis means to shape. So if we put it all together, it's laser-assisted shaping of the cornea in its original place, which is exactly what this surgery does. To understand why LASIK is an effective treatment for myopia, one first needs to understand what the condition of myopia entails. Myopia affects between 20 to 30% of the population and causes difficulty in seeing distant objects. The difficulty in seeing distant objects, but ability to see objects close up, gives myopia its more commonly known name, nearsightedness. Myopia is caused by something called refractive error, which means that the light entering the eye does not focus on the retina, but instead on a different area of the eye. This is because of either too much curvature in the cornea or an eyeball that is too long. So how does a laser fix this? First, you need to access the cornea. There are a couple different ways to do this, but for the sake of time, I will just discuss one of the most common, the usage of a microkeratome blade. The microkeratome is placed over your eye and suctioned onto the surface, ensuring it does not move while working. A small blade on the device then cuts a round flap and pulls it back to expose the cornea. The newest microkeratomes are able to do this in about 3 seconds, making it an extremely quick and accurate procedure. Here you can see exactly how the microkeratome works. Once the cornea is exposed, the surgeon can get to work on shaping it using the laser. For people with myopia, the goal is to flatten the stroma portion of the cornea that light hits the retina correctly. The number of cells removed is based entirely on a person's unique prescription. The laser beam is extremely focused and can work on an area as small as 0.25 microns. While we may think of lasers as burning, that isn't really what goes on in LASIK surgery. In fact, the laser is simply adding energy in order to disrupt molecular bonds and essentially causes the tissue to disintegrate in thin air. Once the cornea has been shaped properly, the flap is placed gently back on top of the cornea. Because of how fast the eye works in healing itself, no stitches are necessary. Antibiotic drops are used to prevent infection, and a shield is given to the patient so that they don't touch their eyes. Healing is very quick, and most patients are back to normal within 2 weeks. So, who is a good candidate for LASIK? Unfortunately, not everyone with myopia is, and patients must fit a specific set of criteria. For starters, a person's vision must be stable. Myopia can be degenerative for many people, and a person's eyes must be stable for at least a year. Most of the time, this will eliminate any patients under the age of 18. You must also fall within a certain range of correction. In general, patients with a prescription between -0.75 and -10 are good candidates. The thickness of a person's cornea also plays an essential role. You are removing part of the cornea during surgery, and there needs to be plenty left after it's done. The thickness is usually measured by a corneal topographer to determine if you are a good candidate. LASIK outcomes are very positive, with the vast majority of patients having 20/20 vision within a year of surgery. As with any surgical procedure, however, there are risks. Any part of the cornea that has been removed cannot be replaced. This means that if a mistake is made and too much cornea is removed, you now have hyperopia. There is also the possibility that not enough tissue has been removed, which would require a second surgery to touch up the missed tissue. Many patients also experience problems with dry eyes and difficulty seeing at night, despite their now perfect vision.